Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixedED, www.fixeded.net.au.
The thing that implanting urologists are most concerned about when we operate on a patient and place a penile implant is the risk of infection. If you put any artificial material inside a patient, and this would apply to any sort of implant, heart valves, new hips, etc., the concern is whether bacteria from the skin get into the wound and onto the implant at the time of surgery. We take every possible precaution to avoid that. That is, we have the patients on antibiotics before their operation. We get them to use antiseptic soap for several days before surgery. They have washes with antiseptics when they arrive at hospital. We make sure they don't have any skin lesions such as pimples or boils. We use very strong antiseptics at the time of the operation. We wash out the operative wound with antibiotics. So every possible precaution is taken. And indeed, the thing that really helps us now is that the implants are either impregnated or are able to be soaked in an antibiotic solution. So when the implant's put into the patient, there are antibiotics on the implant. So with all those steps, the risk of infection is very, very low. Unfortunately, it's not zero, but something like 1 to 1.5% of patients will unfortunately develop an infected implant. Now, in most cases, that won't be a severe infection. The patient won't be unwell, they won't be sick, they won't have a temperature, but the implant becomes infected, the patient is uncomfortable, the wound doesn't heal as it should, and in that situation, we may need to remove the implant. In that situation, if we remove the implant, there's quite a good chance we can wash all the spaces out with antibiotics and antiseptics and put a brand new implant in at the time and salvage the situation. And that would certainly be the thing we would try and do in those very small number of patients that do get an infection.
Penile implant surgery. Your questions and answers with Dr. Christopher Love, urological surgeon, brought to you by FixedED, www.fixeded.net.au.